The Center for Ethics in Science and Technology is delighted to be hosting the Henrietta Lacks Series for the 2011-2012 academic year. I'm Mike Kalichman, Center Director and Professor at UC San Diego. For the fourth program in the Henrietta Lacks Series, scheduled for Wednesday, December 7th, we are fortunate to have Professor Georgia Sadler of UCSD as our lead speaker. A few days ago, I had a chance to speak with Dr. Sadler about her interests in the impact of health disparities and diversity on clinical research, about what people should do before deciding to enter a clinical trial, and the importance of scientists to talk with the public to design better clinical research studies. I hope after hearing from Dr. Sadler, you'll join us on December 7th.
My primary interest is in addressing health disparities, both the good disparities and the bad disparities. We can learn so much from different cultural groups, different age groups, gender differences. By having more diversity at the bedside and in the laboratories, we can ask different questions than we might if we all have the same vision. We can't look at the problem the same way and hope to come up with different solutions. So diversity is a very important consideration in the workplace, at the laboratory bench side, and at the patient's bedside. Trying to find better solutions is what health disparities research is all about. And that field of research is deeply driven by clinical trials. You could have a wonderful idea, but no matter how good your idea is, until you test it, you have no idea if the solution you're proposing will work. Listen to what the researchers are offering you. Think about it. Talk it over with your loved ones, and then you decide. You make an informed decision. If you need more information to make the informed decision, ask your doctor, ask your nurse, ask a researcher. Ask someone who can give you the best information possible, and then make the informed decision. Yes, I would be willing to try this experiment with you. I spend a lot of time talking to the public. I think I've been to every Kiwanis, Soroptimus, you name it, group in town, talking about clinical trials, because we need you, the community, to understand clinical trials. Research is also a two-way street. It's not just what we know scientifically, but working solo doesn't work. We need to know how best to work with the community. And that's where the community's advice to us is very helpful. So we may have a fantastic idea for how to keep a community's blood sugar levels under better control. But we don't necessarily know how to go out and educate the public effectively to do that. And having partners, there's actually a research model called a community campus partnership. And those are really the most effective ways to do research. And most of our scientists here will be following those models. It means that we want your opinion. We need your opinion. If you don't tell us, that recruitment approach isn't going to work. But if you approach our community this way, we'll be very responsive.